In this video, we're going to cover passive range of motion exercises. Following a spinal cord injury, it is really important to do these exercises at least once a day. These exercises will help maintain your range of motion in your joints and your arms. It will also increase blood flow, decrease spasticity, and decrease your chances of getting a blood clot. To do these exercises, someone's going to help you move your arm through its fullest range of motion. There might be some stiffness in your arm, so your fullest range of motion might be to here, and that's okay. With each repetition, the person helping you is going to try and move your arm a little bit further each time. So instead of coming here, they're going to try and push you a little bit further. These exercises should not be painful, so if they are, tell the person that's helping you that they are painful and tell them to back it down a little bit. For the sake of this video, we're going to be doing 10 repetitions of each exercise. Talk to your occupational therapist and they will advise how many repetitions to do and the frequency of doing these exercises each day. For the first movement we're going to be doing today, it's going to be shoulder flexion. Shoulder flexion is moving your arm up and over your head just like this. For me to support her, I'm going to be cupping underneath her wrist with my left hand, and then with my right hand, I'm going to be cupping underneath her elbow just like this. So the movement, we're going to be coming up and over her head, holding it for a brief second, and coming back down. We're going to be doing 10 repetitions of this movement. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. For the next exercise, we're going to be doing shoulder horizontal abduction and adduction. So we're moving our arms out to the side and here across the body. Similar to the last video, with my left hand, I'm cupping underneath her wrist, and with my right hand, I'm cupping underneath the elbow. So I'm going to pivot myself to the side and move her all the way through her range of motion to the side, and I'm going to pivot, come around, and go across her body. So you're kind of doing like a fan motion. And again, we're going to do 10 reps of this. So this is number 2. And we're holding the position for a brief second for each direction. 4, 5, 6, 7, 8, 9, and 10. And relax. The next exercises we're going to do are shoulder external rotation, internal rotation. So it's going to look like this, coming up and then coming back down. So again, with my left hand, I am cupping underneath her wrist, and with my right hand, under the elbow. So we're gonna start in this neutral position, and I'm gonna move her forearm up, and then kind of just go around, pivot around my hand, and move her forearm down. So up again, and back down. We're doing 10 reps. So that was number 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job, and relax. The next exercise is elbow flexion and elbow extension. So again, it's going to be similar to the last ones. Left hand under the wrist and right hand under the elbow. You're going to be moving her arm with her palm facing up, all the way up to the shoulder, and back down into full extension. And we're going to do 10 reps. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. The next exercise is forearm supination and forearm pronation. So I'm going to be moving her forearm up, so her palm is up, and then down, so her palm is down. For this exercise, I like to prop my leg on either the wheel or the armrest on the wheelchair because it just supports her better and supporting her elbow, and I have more capability of moving her arms through this motion. So I'm putting my leg up with my left hand. Again, I'm grabbing her wrist, and I'm putting her elbow here, resting it on my leg. I'm going to be moving her palm facing you, the camera, and then I'm going to be moving it here and facing the door behind us. We're doing 10 of these. So this is 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. For the next movement we're going to do is we're going to do Tenodesis. Tenodesis is when we move our wrist up, our fingers naturally come up into flexion, and then move our wrist down, our fingers come out into extension. If you don't know about the importance of Tenodesis for spinal cord injuries, then you can look at our detailed video and that will teach you about it. For this exercise, I'm going to prop my leg up again on the wheelchair, putting her elbow underneath my leg, moving her arm up, and I'm going to take her through that motion. So I'm going to bring her wrist down, and when I bring her wrist down, I'm going to stretch out those fingers, and then when I bring her wrist up, I'm going to cup her fingers around mine, bring her wrist up, and I'm going to bring those fingers in, making kind of like a claw like this, and then we're going to move down, Stretch those fingers out, move up, making that fist. And we're gonna do 10 repetitions. This is number 3. 4. 5. 7. 8. 9. And 10. Good job. Now we've completed all the motions with one arm. Now it's a good time to rewind the video and move on so you can complete all the exercises on the other arm. Thank you for watching.